Good afternoon. I want to welcome you to our Wednesday press briefing with updates on COVID-19. As of this morning, we've lost over 80 citizens in our community. Please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Now we will hear updates from our community leaders. First, we will hear from City of Albany Mayor Bo Durrell. Mr. Mayor.
Thank you, Chief. I don't have much to say today other than a few observations. First, I want to assure the public that all of us understand that this is an ordeal for the entire community. We know some of you have children in high school who won't be going to proms, who have sons who are looking forward to playing baseball in their senior year, daughters who had other activities at school, and they've been deprived of the better part of the spring of their senior year. These sacrifices are necessary. But more than that, we understand and appreciate and also share the anxiety we have, that you have, about your family's finances. Many people have lost jobs. It is absolutely frightening to see the numbers nationwide of people who have been laid off in the last month. These issues must, and in retrospect, I believe most leaders in our country would now concede that greater precautions should have been taken earlier. We now realize that contrary to being an obstacle to the economy, these greater precautions would have been the best investment our country could have made in maintaining and restoring a strong economy. I say this because in the coming weeks, many citizens will be receiving payments from the federal government. The first payment, a stimulus check, some people were receiving $1,200, some another $500 for children. Please remember, these are funds to help you pay your necessary bills, your rent, your utility bills, to buy food. Please be responsible. This is not an income tax refund. This is not a winning lottery ticket. This is money that your elected officials in Washington have decided to allocate to the citizens of the United States so they can support their families during these trying times. There are some encouraging developments. Dr. Kitchens is here, he'll discuss. We receive a report daily from Phoebe Putney, and it appears that the number of positive COVID patients being admitted to the hospital is down somewhat from a spike in late March and early April. I have no doubt that some of this is attributable to social distancing and the measures the vast majority of citizens in our community have taken to protect themselves and others. Miraculously, it's my understanding that not one inmate in the Dougherty County Jail has tested positive, and we have not had a confirmed case amongst the approximately 800 or 900 people who are homeless here in Dougherty County. We want you to remain vigilant, to be responsible, concerned about yourself and others. Thank you for your cooperation, and together we will get through this. Thank you.
Thank you, Mr. Mayor, for your comments. I'd like to bring up now Dougherty County Commission Chair, Mr. Christopher Cohilas, for some remarks. Mr. Chairman.
Thank you, Chief. Thank you, Mayor. I want to begin again by just saying to all of the families, the more than 80 families that have lost loved ones, that we are sorry for your loss. We get it, we understand it, and you are in our prayers. Right now, as I speak, there are 62 people that are on ventilators at Phoebe Putney Hospital. 62 citizens, 62 souls, 62 people from this community or surrounding counties that are literally on a machine that is breathing for them. These are COVID-19 patients that have literally reached that stage in their life where they have to have a machine breathing for them. Some will survive, some will die. That is the image that I want to continue to try and burn into the public's mind. The decision as to whether or not to social distance or not. The decision as to whether or not to pack up 6-10 people in a vehicle or to have a big barbecue or not literally determines whether or not we go to 63 people on those ventilators. That is a massive number of people to be on a ventilator. And in the same breath, I also have to say this. We are actually seeing signs of the curve flattening. We know that what we have done, that we instituted in this community before almost any other community in the state, that our efforts are actually making some impact. We have to continue to do these things in order to overcome. This is a marathon, it is not a sprint. It is a test of endurance. It is not a test of acute response. This isn't like a tornado. It's not like a hurricane where it happens and then all of a sudden you just go out there and pick up the pieces. No, this is literally like boxing a ghost. And you have to be vigilant, disciplined, and diligent. Because as we move forward through this, if we take our foot off of the neck of this virus one day, our hospital can become completely overflowed. We can have a run on our resources that literally causes people to not be able to get the services that they need. Right now, we're fortunate that we were able to get so many resources to our community at this time to be able to address this virus. We're thankful to the governor for the many resources that we've set up. We've literally had to set up Phoebe North as a coronavirus surge facility. Phoebe's making use of both campuses. Literally, they're building pods to put into the parking lot of Phoebe North so that additional people can receive services. Additional people can be on ventilators. Additional people can be in ICU. So when you have the opportunity to have to make the decision as to whether or not you're going to social distance or whether or not you're going to go out in the public and wear a mask or not wear a mask, I would ask you to do this. Imagine a loved one of yours on a ventilator, struggling to breathe, fluid filling their lungs, and a machine breathing for them. That's the image that I want the public to continue to burn into their minds. Because literally these decisions are life and death decisions for many. Others may never know they haven't. And for those of you who think, oh, I'm young, I'm healthy, I'm strong, well, guess what? You may be and you may never feel the impact of the virus. You may never even know that you've been infected. But you know what? You have people in your life that you are connected with, that are family members, that are vulnerable, and that may die. So think about those things when you make your daily decisions. I want to thank the governor's office for working with us. We were fortunate here recently to be able to get a lot more resources for Phoebe Putney Memorial Hospital. I want to announce and I want to thank Target for their donation. I worked very hard with the governor's office and with Target to be able to get a large shipment of N95 masks for healthcare workers. 10,300 KN95 masks are going to be coming in, I think, in the next week or so to support our healthcare workers. And then that will be followed by another shipment. That is a huge donation by Target, and I want to thank the governor for helping steer that to us. We were looking for these resources, and the KN95 masks are special masks that are utilized by our healthcare workers, and that frankly in a lot of other communities people aren't even able to get. And so that is awesome, and I again want to continue to just say thank you to our healthcare workers who go in every single day, put on a mask, and fight a ghost. I want to say thank you to every one of our first responders, our EMS, our police officers, our sheriff's deputies, the folks that literally are having to interact with the public and respond to calls where people either may or may not have COVID-19. And then they have to go home and kiss their husband or their wife at night, hoping that they haven't contracted the virus. That's a real anxiety and it's a real stress on a lot of people. And I want to just say thank you, thank you, thank you for all that have been working in this battle. Again, I remind everybody, the governor's shelter-in-place order is through April 30th. His emergency declaration is through May 13th. We're going to be working with the governor's office and our other local and state partners to try and get as much information as we can about whether or not the shelter-in-place order will be extended beyond April 30th. I don't know the answer to that, but again, to reiterate, what does shelter-in-place mean? It doesn't mean to go to a vacation home. It doesn't mean to go to your boyfriend's home in another county. It doesn't mean to go stay with another couple. It means shelter in place. It means shelter in your home with your family and only venturing out to conduct necessary and essential business. Again, funeral services. This is very, very important. 10 or less. There's a real risk with our funeral services. Many people have passed away, and it's a horrible thing. We don't want more people to pass away. And many of the people that are passing away had the virus and died as a result of complications from the virus. Therefore, the people that they had closest contact with may have contracted it as well. So now you're gathering people that may or may not have been exposed to the virus, along with other people that may not have been. That's how we already know that we experienced, how we initially received such an influx of this was through funerals, and no one did anything wrong. No one did anything wrong. I want to make that very clear. It's a shame that any citizen has had to suffer what our community has had to suffer. But follow the rules. The rules are in place to save lives. Saving lives is important to our community and to our families. Again, law enforcement is going to continue to monitor funerals and at our stores. People have asked, are we enforcing the order? Absolutely. Every single day, the Sheriff's Department, the Police Department, the Dougherty County Police Department go out and check businesses. They respond to all of the calls that come into the Emergency Operations Center. If you see violations of the governor's order, please call the Emergency Operations Center. Make that report. Don't call 911 to report a social distancing violation. Call the EOC so that the people who have somebody that may be dying of the coronavirus in their home and are experiencing a real emergency, they can make use of 911 in a more efficient manner. Again, I want to say thank you to our business community. There's been some confusion as we've instituted the governor's order. Some folks didn't understand that they couldn't be open. Others had questions. We've been working through that. We appreciate the business community's cooperation. And look, I understand and appreciate. We got a lot of folks that are out of work right now. And it's going to hurt and it's going to be hard. And I don't have all the answers, and I'm not elected in Washington to make those decisions. What I'm doing here locally is advocating. I'm speaking to our local, state, and federal delegations to make sure that they're aware of our problems. And I hope to God that the stimulus money is distributed quickly and amongst all of our families as soon as possible. I totally agree with what the mayor said, is this should not, don't use it, be frugal, because this may be a long winter. And I don't know what the other side of this looks like right now, and we're not there. Right now we have to be vigilant and diligent and disciplined. Again, I thank you all. I thank our citizens, and I want to acknowledge that the large majority of our community is doing the right thing. And frankly, we're getting calls from all over the country, all over the state, asking how we're doing what we're doing, how we're managing what we're managing. And I think that it says a lot about this community, the fact that we are Albany strong, that we've been able to hunker down and fight this thing. Thank you.
Mr. Chairman, thank you for your remarks today. I'd like to turn now to an update from Phoebe Putney Memorial Hospital. Dr. Stephen Kitchen is here. He is the Chief Medical Officer. I'd like to bring Dr. Kitchen up for some remarks.
Thanks so much, Chief. And I've got a number of items I would like to include in my report today. I will certainly share with you our updated numbers regarding COVID-19, as well as some trends that we have seen recently emerge. Also, we have a very, very dedicated group of physicians and others at the hospital that are doing a very in-depth analysis of our own internal data regarding COVID-19 patients at Phoebe Putney. And like I said, we're working in concert with the CDC, the Department of Public Health, as well as through a research collaborative with the Medical College of Georgia in Augusta to really do a deep dive, because I think there's going to be a lot of very compelling findings that we will find that will, I think, provide great insight both within our community, but I think will have implications both on a state and national level regarding really the dynamics of this devastating illness that are still really only being revealed to us now. So, as of today, we have had almost 1,900 people in our community who have tested positive for COVID-19. And, you know, I want to underscore that number because, you know, that represents almost 2,000 individuals in our community who have been affected in some degree by COVID-19. Some of them have had a very mild course of illness, but as you well know, many of those people have become seriously ill, and unfortunately, we have lost far too many people in this community due to the consequences of COVID-19. So overall, we've had a little over 5,000 people who have been tested for COVID-19, 5,400 or so. So basically, what that means is about 35% of people who are being tested through Phoebe Putney Health System are testing positive, and about 65% are testing negative for COVID-19. Now, if we've had a total, and of course, we've had a total of 67 people who unfortunately have expired. And that is not only at Phoebe, Maine, that includes Phoebe Sumter as well. So if you take that number 67 and you divide it by the total number of patients who have tested positive for COVID-19, that comes out to an overall mortality rate of 3.5%. That correlates pretty closely with what we're seeing statewide, but I want to emphasize the point that the mortality rate for patients who become seriously ill and have to enter our hospital is much higher than that 3.5%. And I'll cover that a bit more. And I know this doesn't project, but this is a heat map that is made available through the Department of Public Health website, which can be easily accessed. And what it will show is that, unfortunately, Dougherty County and our surrounding counties by far have the highest rate of COVID-19 per capita per 10,000 residents by far and away than any other area of the state. Also, we have the highest death rate of any other area in the state. And that is, like I say, directly proportionate to the number of cases that we have here. We've had over 1,000 patients who fortunately have recovered from the illness. But like I said, we've had 67 patients who have unfortunately expired. And again, I want to emphasize the fact that's just not a number. That's not a statistic. What that represents is somebody's loved one. That's someone's mother, someone's father, someone's husband, someone's wife, someone's son, daughter, or close loved ones. I know everyone in this room has unfortunately experienced the loss of a loved one or close friend. And so you've heard a very, very impassioned plea by Chairman Cohilas and Mayor Dura to, follow the advice that you have heard in terms of social distancing and those other public health measures that we know are the ultimate key to defeating this disease. And I simply, on behalf of the medical community, want to echo and reiterate what they have said. Please, 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 the most effective measure that we can implement to curb the impact of this disease are all the measures of social distancing that you've heard time and time again. I think there are some favorable trends, and again, I want to emphasize the fact these trends, these favorable trends, are absolutely directly related to the social distancing and other effective public health measures that your public health officials have fervently implemented over the last several weeks. So I have a couple of graphs here, and I'm sure it doesn't project well. One shows the number of new patients who are admitted to our health system hospitals on a daily basis, and fortunately, that trend is beginning to go down. We also have a cumulative number of the positive cases that we have seen, and I think what you see is that there is a very steep rise in that curve that occurred in mid-March. However, over the last week, that curve is beginning to flatten out. And I think the terminology you've heard again and again and again is flattening of the curve. And I do think, based on what the trends we have seen over the last week, we are seeing some evidence of that. But again, I want to emphasize This is no time for complacency. This is no time to deviate from all the social distancing and public health measures that you have heard, because that is why this trend is beginning to flatten. And if we deviate from that, unfortunately, we know how infectious and communicable this virus is, and it would not take much at all to reverse those trends. So again, we look every day at the number of patients who get admitted into our facilities with COVID-19, as well as the number of patients we've had to transfer out. Because like I said, we have been topped out on our ICU capacity for several weeks. In fact, I will tell you, for the first time today in over 3 weeks, we came off of what we call ICU divert, which means for the first time, we've had ICU beds available at Phoebe Putney. And like I said, I think that again is a manifestation of all these steps that we are seeing. So I will tell you, basically in mid to late March, we were seeing up to or over 30 patients a day come into the emergency room at Phoebe Putney here in Albany with signs and symptoms of COVID-19 severe enough that they warranted admission to the hospital or admission to the intensive care unit. Some of those patients we could not accommodate because we didn't have beds. So we look at what that total is, both the number of patients admitted to the hospital plus the number of patients we had to transfer out because we didn't have an available bed. That number was well over 30 a day. I will tell you, over the last week, and this number does jump up some, those numbers are now down into the 20s and actually into the teens. Now, I will tell you, on the 9th, we had 25 patients that day, but we had 18 yesterday, 16 the day before. So what I'm trying to convey is we're beginning to see evidence of a favorable trend. You know, we've talked about the devastating impact this has on patients, as well as the toll that it takes on our healthcare workers as well, particularly for patients who are critically ill in our intensive care units and what trends we are seeing there. And again, I just want to reiterate the fact I cannot say enough about our frontline staff and what they do every day to provide extraordinary care. But we are seeing more and more patients who are recovering in the intensive care unit and are able to be transferred out. So in the month of April, we've had a total of 27 patients who have recovered to the extent that they've been able to be transferred from the intensive care unit out to one of our general medical floors. I want to emphasize this is a long and arduous struggle and battle before them, because these patients are seriously ill. They're debilitated for a long period of time, and they have a long period of convalescence and recovery behind them. But we are seeing some favorable trends there. I do want to share with you an analysis of our internal data at this point. And again, you know, I think our position is we want to partner with our community, with our patients, with our federal and state agencies as well, and marshal all resources at our disposal in fighting this deadly disease. And part of that is being very, very transparent with the data that we have. And so what I will tell you is this is our internal, an analysis of our internal data that goes through April the 9th. And so it is the first 159 patients who were discharged from the facility or unfortunately had expired. So that is that number is 159. Of that 159, unfortunately 33 expired, which is a mortality rate of 20.8%. So again, I want to emphasize, although if you look at what our overall mortality rate is, 3.5%, I want to emphasize the point that we have to deploy every measure at our disposal to prevent people from contracting this virus, because we don't know which one of your loved ones is going to become seriously ill enough that they're going to require admission to the hospital. So like I said, that overall mortality rate is 20.8%. There's a striking disparity with regards to the ethnic makeup, because of those 159, 147 were African American, which means of the 159 patients who were admitted, basically 92% were African American and about 7.5% were Caucasian. If you look at the various risk factors, certainly age is one of that, and that's what we would expect. We've spoken time and time again, people who are elderly, people who are fragile, people who have chronic underlying medical conditions are more at risk for serious illness, admission to the intensive care unit, and unfortunately death. What I will tell you, and I think these statistics are very much consistent with what we have seen on a national level, is that 38 of the 159 required admission to the intensive care unit. So that's about 24%. Of those 38 individuals, 25 expired. So that is a death rate of 65%. So again, I want to re-emphasize the fact that for patients who become seriously ill and require admission to the intensive care unit, and particularly if they have to be mechanically ventilated, the mortality risk is exceedingly high. And so for patients who are on a ventilator at Phoebe Putney, the mortality rate is about 77%. I'm going to tell you that's very much in line with what we're seeing on a national level. I've seen that rate anywhere from about 60+%. That's based out of the experience at the University of Washington in Seattle, up to 97%, which was the experience in Wuhan, China. So again, I want to emphasize the fact that if we're really going to impact the devastating effects of COVID-19, the way we're going to do that is by decreasing the overall number of cases that we see and the prevalence in our community. Lastly, I would like to speak a little bit about our surge plan and the plans at this point to bring on Phoebe North as a COVID-19 facility. And I certainly want to emphasize the fact that the governor's task force, and all of our state officials have just gone over and beyond to recognize the crisis that we have in Albany, Dougherty County, and Southwest Georgia, and they have disposed an enormous amount of resources to put in place so we can stand up Phoebe North as a COVID-19 facility. I will share with you there are 4 phases of that plan. Phase 1 is to bring on 12 additional ICU beds and 15 general medical beds at Phoebe North, and that plan is really effective to go into effect sometime next week. The critical aspect of that is really to have all the staffing in place to be able to provide those services, and particularly finding ICU nurses to be able to staff the 12-bed ICU as well as nurses to staff the 15-bed medical unit as well. But again, I want to emphasize our appreciation to the governor, the governor's office, and all the officials. I know that GEMA has been intimately involved in this as well. And my hope is that we never need those beds. But again, we have to be prepared. And what we're trying to do is look 3 steps ahead, look at what our first contingency plan was, our second contingency plan, and our third. So what I will tell you is we will continue to have absolute resolve to basically commit to all the resources, all the manpower, all the supplies and so forth that it will take to continue to meet the needs of our community and respond to this public health crisis. So thank you again for your time, and that concludes my report.
Thank you, Dr. Kitchen, for your update today. And now we will move to the Director of the Southwest Georgia District of the Department of Public Health. Dr. Charles Ruiz is here to provide an update. Dr. Ruiz.
The Southwest Georgia Public Health District is comprised of 14 counties, and Dougherty County is the lead. So I have the responsibility and the privilege of working with public health in Dougherty County, but also the other 13 counties. In the world of public health in the state of Georgia, we have a mission that is 3-pronged. The first part of that mission is to prevent sickness, disease, and disability. And the second is to promote health and well-being. The third part of that mission is to prepare for and respond to disasters. Oftentimes what we do is kind of under the radar and behind the scenes. I don't have time to list all of the activities that we do, but I'll just mention a few of the things that we do on a typical daily basis. And they include the control of tuberculosis, rabies, and sexually transmitted diseases. We administer the Women, Infants, and Children's program, better known as WIC. We are involved in other children's services, also in family planning. Our environmentalist team is involved in ensuring the safety of the food and water that we consume. Our epidemiologists monitor and track communicable diseases throughout the community. Those are just some of the things that we normally do, and oftentimes it goes unnoticed. In fact, that's the way we prefer it. But our emergency preparedness team is busy year-round, preparing for events like hurricanes, tornadoes, man-made disasters, and diseases like COVID-19. They have been working tirelessly over the past few weeks. One of the things that they do is they keep a stockpile of supplies on hand, and early on in this pandemic, those supplies were handed out to entities that needed them throughout the community. They were quickly exhausted, And since then, our team has been serving as a conduit for supplies that come down through the state and through the federal government. We have been challenged to provide the same level of routine services and to respond to this disaster simultaneously. We've been forced to cut back some on the days that we offer essential services. So currently, our goal is to provide at least 3 days per week of the essential services. Many of our clinical staff members are involved in collecting of specimens that are then tested for COVID-19. We began that several weeks ago here in Dougherty County, and since then we have expanded. We now have 3 locations where we are collecting specimens on a routine basis. In addition to Dougherty County, we have a collection site in Thomas County and one in Miller County. As time goes on, we may be able to expand that into other communities. We are constantly looking at ways that we can get our results back quicker. And on the horizon, we think that we will be able to partner with a new laboratory that will allow us to do that. And we are happy to provide this service, and I've shared the telephone number before, and I'll do it again. So for people who are interested in calling to have the testing, the number is 229-352-6567, 352-6567. This number is open all day long on Monday through Friday from 8:30 to 5, and it's open on Saturday mornings. We have a fairly lenient list of criteria that apply to many people in the community. So those who would be eligible for testing would include people with symptoms consistent with COVID-19, including fever, shortness of breath, and cough, loss of taste or smell, chills, and certain gastrointestinal symptoms. People who are 60 years of age and older are eligible to be tested. People who care for someone who is 60 years of age and older are eligible. People with serious chronic diseases that would include heart, lung, diabetes, and immunodeficiency are eligible. People who care for those with a compromised immune system would be eligible. Healthcare workers are eligible. First responders are eligible whether they have symptoms or not. Again, healthcare workers, whether or not they have symptoms, and first responders, whether or not they have symptoms. And last, people who live or work in a congregate setting are all eligible. So we urge you to call and set up an appointment. We'd be happy to test you. Currently, in Dougherty County, we are collecting specimens at the Dougherty County Health Department on South Slappy. I'll reiterate, it's very important that you practice social distancing, and by all means, if you are sick, stay home and call your provider for advice.
Thank you, Dr. Ruiz. Now we will hear law enforcement updates from Dougherty County Sheriff, Kevin Spruill. Sheriff.
Thank you, Chief Scott. I want to thank all the citizens in this community that have worked very hard with our task force team and with the leaders of Dougherty County in trying to flatten this curve and eradicate and get rid of this virus that we're all been dealing with. I personally want to thank our law enforcement brothers and sisters out there who have been working real diligently in this very difficult time. It's been a very great effort from all the agencies in our community and even from our state who has come in and assisted us, and I really want to thank y'all for that. As I said at the outset, patience is going to be the key to all of this, and you've already heard our mayor and our chairman and Dr. Kitchens and Dr. Ruiz speak about what we're dealing with, and we're going to have to continue to be patient. As we move through this 4th week and into our 5th week of this COVID-19 here in our community, I want to stress the importance today of adhering to the governor's order, especially when it comes to social gathering with our funerals. You heard the chairman speak earlier about the funerals and the 10-person rule, and that is very important. I know personally myself, I have missed 5 funerals in the last 3.5 weeks that I could not attend. And I know many of you out there have missed some funerals also. I understand what you're going through, and down here we're always accustomed to attending funerals and paying our last respects and hanging out at the cemeteries for sometimes hours on end with family members. But let me just share with you, please use other methods to pay your respects during this time. Use telephone calls, emails, text messages, social media platforms such as Facebook and Zoom and others. Mail them a card or a handwritten letter. There will be times after all this is passed where we can get together and gather and eat all the fried chicken and other food that goes with it, all the cakes and desserts, and spend time with these loved ones. And I know it's very difficult right now for you. I've tasked my deputy sheriffs to work and assist with our funeral homes and with our coroner in carrying out this order. We all have been and we will continue to monitor our funerals and our cemeteries. We get a list every day. We have deputies that are assigned to various cemeteries around our communities, and we will strictly enforce this order by the governor. So you may be cited. So please take my warning, heed my warning. Please do not show up at these funerals unless you're one of less than 10 people, 10 or less that can be there. We're also averaging over 300 compliance checks daily with the sheriff's office. And you know whether you're an essential or non-essential business, you know whether you have a 16-point or a 20-point checklist to follow. If you have any issues there, please contact the Daugherty County Sheriff's Office. You can reach us at 431-2166 or call us at 302-3600. Again, that's 431-2166 or 302-3600. We will try to help you with any part of the order you may not understand. We will help you as a business with compliance issues if you're having any. My men and women have been working long hours out there. They're checking these businesses, they're checking these cemeteries. We're here to protect you and to keep you safe. And while we're doing all that and taking away from some of our normal everyday activities, I'm asking you as a citizen, everybody does not see this press conference. I have been told several times over several days that, oh, I didn't even know you had a press conference. What time is it? We don't know where it's at. We don't know when it is. We don't know who's carrying it. We don't know what platform to watch it on. I tell people, if you have seen these press conferences and you've heard these individuals come up here time and time again and urge our citizens to adhere to this order, please help us with this. Tell your loved ones, tell your neighbors, tell your friends and family members. We're paying attention to the social media platform at the sheriff's office. We're seeing teenagers out there video recording these fights and all these other incidences that are going on. We're watching this. We're seeing this. We can't be everywhere. The police departments and the sheriff's office cannot be everywhere, so we need you to please step up and help us where you can. And I know many of you have already done that. That's how come we have access to some of this, because of some of the citizens who have helped us with this. So thank you again, and may God continue to bless you and your family.
Thank you, Sheriff, for those updates. Now we will have updates from Daugherty County Coroner, Mr. Michael Fowler.
Good evening. I'm just going to go into the presentation today, another day before spent. We're going to go into the, we have a total of 83 deaths in residents in Daugherty County as of today. So I'm going to break down the locations that we have had the residents of each death. The known address, we have about 4 we have not found, but these are the known address. 31721, we have a total of 6 deaths. 31707, we have a total of 9 deaths. In East Albany, 31705, we have a total of 11 deaths. In the South On 31701, we have a total of 3 deaths. In 31701, we have a total of 31 deaths in South Albany. 31 deaths. A breakdown of the gender: females, we have a total of 45 females, that's at 54%. Males, we have a total of 38 at 46%. Race: white, we have a total of 20 at 24%. Blacks, we have a total of 63, a total of 73%. White males, we have a total of 7 white males at 8%. We have a total of white females at 13 of them at 16%. Black males, we have a total of 31 at 37%. Black females, we have a total of 32 at 39%. The breakdown of the age: 30, we have a total of 2 in their 30s. In their 40s, we have a total of 6. In their 50s, we have a total of 2. In their 60s, we have a total of 30. Really supposed to be 30 now. I didn't change that. In the 70s, we have a total of 15, and they're going up to 17. In the 80s, we have a total of 18. In the 90s, we have a total of 8. And the average age is still 71.5. So we have a total of 83 deaths in Dougherty County. And that's, like we said earlier, 1 death is too many. Thank you.
Thank you, Coroner Fowler, for your remarks. I want to leave you with a few words of encouragement and determination. We are in this crisis together, and only by working together and supporting each other will we be able to get through it. We are a strong community here in Albany and Dougherty County, and I know we will persevere. May God bless each of you, and we will see you back here on Friday at 1 p.m. This ends our press briefing for today. Thank you.